My name is Chelsea Neufeld, and this is my cardiac cycle oral report. Autorhythmic cells of the SA node receive a signal to open up the voltage-gated IF channels, and sodium flows in and depolarization begins. When the threshold is reached in the SA node, voltage-gated calcium channels open, and then calcium rushes in, generating an action potential in the SA node. The action potential is then propagated from one cell to the next through the movement of ions through gap junctions. The propagation moves first through internodal pathways to distribute the action potential throughout the atria to get to all of the cardiac contractile cells. The wave of action potentials causes the atria to contract, and their pressure causes the last of the blood to the ventricle to top off ventricular filling. While the atria are contracting, the electrical signal has then made its way to the AV node, where the signal is delayed because in the AV bundle because there are fewer gap junctions. And this is when the signal moves from the atrial side to the ventricular side. The action potential is quickly propagated by the left and right bundle branches through the heart to the apex of the heart and then to the sides to distribute a wave of depolarization to all of the cardiac contractile cells of the ventricle. On the atrial side, the wave of repolarization causes the atria to relax, and while the wave of depolarization on the ventricular side causes the ventricle to contract. So the ventricular pressure goes up while the pressure in the atria goes down. Ventricular pressure causes the AV valves to shut, which ends ventricular filling and causes the first heart sound. Then isovolumetric contraction begins. At this time, all the valves are closed and the pressure is rising until the pressure in the ventricle is greater than the pressure in the conducting arteries. When this happens, the semilunar valves open and ejection begins and continues for about 100 milliseconds. Ejection is where the blood is ejected into the conducting arteries. Then a wave of repolarization occurs when voltage-gated calcium channels inactivate. The wave of repolarization causes the ventricles to relax. So the pressure drops and becomes less than that in the conducting arteries, causing the semilunar valves to snap shut, which causes the second heart sound. When the semilunar valves shut, they expose the coronary arteries. As the aorta rebounds, the blood goes into the coronary arteries to perfuse the heart. Because the valves are now closed, the ventricles now relax in isovolumetric relaxation phase. As the pressure drops, the pressure in the ventricle becomes less than the pressure in the atria, and the AV valves open because the ventricular pressure is less, and then the blood goes from the atria into the ventricles, and ventricular filling begins. And that is the end of my report.